I think first figuring out what you love, right? What is it about PT you love? And then once you identify like where is your passion, make work your hobby. And so by making work your hobby, that allows you to then, grow both intellectually in the area that you enjoy, but then also, be rewarded for it in the end, right? So that's at the end of the day, unfortunately, finances are always going to be a part of every scenario we would discuss. And so, then, making sure that your time is valued for that. And once you kind of recognize the time and value that you put into something, then you can see the rewards on the back end.
Hello and welcome to Ortho Static, the podcast of the Academy of Orthopedic Physical Therapy. I'm James Spencer. With me is Matt Haberl. And we recorded a recent episode talking about being in the business of physical therapy. We had set out to talk about cash practice, but we ended up going into a whole bunch of different topics. And even after the recording stopped, Matt and I just kept talking about stuff. And we thought it'd be great to come back on and record a couple shorter segments on a few different topics. So here we are, and I hope you enjoy this episode. As for me, I own Ajax Physical Therapy in Aspen, Colorado. We are a home-based practice, mostly out of network, not accepting insurances. And I've been in practice in that area for about 3 years. Matt is with Dynamic Performance and Therapy in La Crosse, Wisconsin. And I'll invite you to say a little bit about your practice, Matt.
Yeah, so we've been in practice for 9 years, and we're in an outpatient clinic in La Crosse, Wisconsin, where it started out with kind of 3 physical therapists, where we were kind of doing our semi-solo gigs, but wanted to market a common brand and change kind of the focus of what PT was in our area and community. And we've now grown to 9 practitioners, and then we have a couple supplemental staff, so 12 total staff now. We are still 75% in the self-pay world and probably 25% in the insurance world. But I would say, got started out in that kind of solo and then kind of just kept growing with demand. And, so here we are. And that's what I think sparked a lot of our conversation last time, and just of how we've kind of, grown over the last couple of years, and what's been successful, what hasn't been. So.
Yeah. And I'll say, one of the things that sparked this is again, I've been in my practice for about 3 years, and Matt was saying some things when we recorded the last episode, that it seemed to me like he's captured and operationalized some of these things that I'm just kind of seeing and starting to grapple with and figure out. So I was joking to Matt that this is kind of him consulting on my business, but we'll see where this conversation goes. One thing we wanted to start out with as a topic is new grads coming into practice and different implications of working in different settings. Well, I guess one place to start with that conversation is I hear a lot of new grads coming out and wanting to go right into their own private practice. For me, it was something that happened after 15 years. What was your experience, Matt? What are your thoughts on it?
Yeah, I mean, full disclaimer, like when I walked out, I won't say how many years ago, but the gray hair can tell you it's been a while at least, right? So, I was actually anti-private practice, and so, coming out, just not really knowing what the private practice world had to offer. And so I went into more of a hospital-based system, and really did enjoy every moment of it, and had an opportunity to learn along physicians and other providers. And now, I would say there's, in a sense, a push back to like the small private practice. And when I kind of talk to people about this, I kind of give 3 different analogies. One is you've got your corporate healthcare, and I'm going to include your large hospital systems, and then even like your larger private practices, multi-location private practices and physical therapy. Those would be similar to like a cruise ship, or a large ship, right? Where everyone has their role on the ship, but for you to kind of really change course of that ship, unless you're at the top, unless you're the captain, you're really not making a lot of, there's a lot of people you got to talk to, a lot of levels you got to go through to kind of get to the top, right? And then where we kind of started was that kind of sole practitioner, and kind of maybe where you're at, James, where, you're on your little kayak, and what's beautiful about that, you can go where those big ships can't go, right? You can kayak into into the little lagoons and see all the beauty that's there. But then there's a little more risk with that too, right? You're by yourself, you're kind of out there, when you need to get out of the kayak and, take a vacation. And I mean, there's nobody in the water anymore, right? So there's nobody filling your shoes. And, where we've kind of settled, I'd say, I like to say we're on a yacht, right? Yeah, one day you may be the cook, right? So one day you're cooking, one day you're cleaning, another day you're seeing patients, and that's kind of the beauty of it. But we get to still see, we get to go into a little bit of the rougher waters, but we also get to get into some of those more shallow places. And we still carry along a little dinghy, so we can still go out into those little waters too. So I think when we look at like new grads, wanting to start their own things, like I think it's being aware of that, like you went to school for physical therapy. That's just when you go in on your own. I mean, one part is running a business, another part is seeing patients, right? And so there's a lot to learn, and I'm thankful for everything I've learned up until this point, to where I was able to then exit and go into private practice. Because I think that made the PT side of it easy, right? So patients still were patients, but the business is where I then had to spend a lot more time and energy. And I can see it be challenging for both. But we do think it's viable. Like, we also offer residency education that creates mentorship with the patient care, but also, teaches them also the business side of more than just the physical therapy part of our practice, right? Running a business, there's a lot more elements to that.
Yeah, I mean, the thing I hear myself saying a lot recently is I was a physical therapist for 15 years, before I jumped into private practice, and of course, there's always room to learn and grow in physical therapy clinically, and I believe that's stronger the longer time goes on. That there's always more to learn. There's always new information, but I can't imagine starting a business, working in that business, and like you said, like being everything, being the cook, being the captain, being the physical therapist, and while doing that, learning how to run a business, but also then having to learn how to be a physical therapist. I'm so glad that I have a lot of time under my belt, and I feel comfortable being a physical therapist. And now I just have to figure out how to run a business, and the learning curve has been steep. So I worry, I feel conflicted on it, because I think our profession needs a wave of private practice owners and people owning their own businesses to come in and push more business values into our profession. But I'm also leery of people coming straight out of school, still trying to figure out how to be a physical therapist, and then also trying to learn how to be business owners at the same time.
Yeah, I would agree. I think you and I may are kind of on the fortunate side of things. Is I always say there's two different types of practices out there. There's the practice that's a business that markets themselves well in the realm of physical therapy, and then there's physical therapists out there that they're successful and their business operates because they're so successful, right? And I think that, personally, I feel like that's where our brand has come from. Is, like, we are physical therapists first. The business is successful because we are good at what we do, and that is our trade. And versus you could go to the other side and, market, business analytics, and we can still get patients in the door that way. But I think what side of that realm do you want to spend your focus on, right? So.
Yeah. Yeah, and so you say in your residency you're teaching people some business acumen.
Yeah, so because we're a little bit more about our like model is we're not just an hourly based kind of reimbursement structure. Our goal is to help our practitioners fill their schedules and then maintain a stable schedule, really. And so then by doing that, then also teaching them the numbers behind that, right? So what do these numbers mean? If you do take a week off of vacation, it's not just you that suffers, it's all of us that suffer. And so teaching them that side of it, also teaching them the marketing component of it, how do you get out in the community, and again, really, it's really just helping these kind of new grads find what they love and go do it, and then, by doing that, teaching them, how to be, stronger physical therapists in that. So they kind of go move in parallel. The residency is heavily on the clinical side, but then the mentorship dribbles in how these two are related. So it's for us, it's been really successful. And again, I think for us also, it helps us understand our product we're providing, kind of maintaining that brand name that we provide. So
I think that's fascinating. I worked. I was a travel PT for a whole bunch of years, working all over the place, but larger home health agencies, some smaller community hospitals, but still big institutions, with like you were talking about earlier, the cruise ship with layers of trying to say a kinder word than bureaucracy, but layers of supervision above me, and so I was always limited to what that organization allowed for my practice. um, and my thoughts going in like two different directions. Like
yeah,
there was a certain comfort to that of like showing up to work, doing the practice, doing physical therapy, and just doing the job, seeing the patients, moving on with the day. And I don't think I ever had that education that you're talking about, of trying to teach your residents kind of about the monetary side of it and the marketing side of it a little bit. And so I'm definitely having a crash course in that now.
yeah.
Um, yeah,
And that's what I'd say is probably the biggest thing, like I was probably the disgruntled employee, in the big cruise ship because, I only saw my linear perspective, right?
mhm.
Now I'm on the other side of it and I'm seeing all the administrative, like, oh, this is why they have all these policies and procedures. Oh, this is why we do these operational things. So now it's kind of that balance of like, because I do feel like it's, on one side in like the large corporate system, like you have all these check boxes, you have your little place that you stay within, so you feel like you just got handcuffs on all the times. But then now on the other side, it's like you don't want to create that same environment, because that's wasn't the environment I enjoyed. So it's like creating that little bit of latitude, but also maintaining minimal risk on the business, right? Because everyone's affected in that scenario. And so it is kind of, like I said, it's perspective is always both directionals. And so like once you kind of see all perspectives of everything, that's how we grow, right? And so I think it's kind of, again, I think that's why it's been rewarding to have those perspectives in place in the beginning to then help shape our practice now. And not to say that you can't get there starting out with your own practice. I think it's just allowed us to accelerate faster because we have.
And to absolutely put you on the spot here for a minute, what are there a couple or few things that you could, that are piece of advice that you would give to a new grad to increase their the way they think about the business side of physical therapy a little bit, or the way they think about the attracting patients and that sort of thing? Are there a couple tidbits that you could give?
I think first figuring out what you love, right? What is it about PT you love? And then once you identify like where is your passion, make work your hobby. And so by making work your hobby, that allows you to then, grow both intellectually in the area that you enjoy, but then also, be rewarded for it in the end, right? So that's at the end of the day, unfortunately, finances are always going to be a part of every scenario we would discuss. And so, then, making sure that your time is valued for that. And once you kind of recognize the time and value that you put into something, then you can see the rewards on the back end. I would caution those to go at it for purely financial reward, right? There's a lot of different, I could have done a lot of different things in my career and probably been richer than I am today, but that's not where I value life, right? My life is not valued in that manner. And I think the people who chase the golden coin sometimes, especially when they look at it from a practice standpoint, it can lead you down some rough roads, right? It can be the road can be challenging sometimes, but don't get me wrong. We still need to, our time is valuable. Our profession provides value, and that's, we can get rewarded enjoying our hobby at the end of the day if you kind of take that, I'd say philosophical approach, in my opinion. So
I think I came in with an intention to keep these episodes bite sized, and I can see where you and I could just we could just keep talking forever on this. But I'm gonna use this moment to get on my soapbox, and then we'll close down this episode, and we'll move on to another topic next time. But a couple things burning in my brain. It sounded like you were talking about short-term gains in as a new grad coming out wanting to make a lot of money because you got a lot of loans and you have needs. but making sure you maintain that long-term focus, looking at what your professional goals are over the next 20, 30, 40 years. And I think if you build that strong clinical foundation, if you get into areas that you really love in this profession, then you're going to have a lot more success and happiness down the road. And it may take a little while to build up to get those paychecks that you're looking for and that you feel like you need right now. And I certainly understand that, but I think having the long view is something in our profession that can be very advantageous to a person. And we keep kind of talking about like bigger organizations and little practices. I know a lot of, and we've skirted around this topic, and it's kind of off topic from what we're talking about, but I have to mention it is advocacy in your workplace. The hospital I worked for here in Aspen, we were fortunate enough, our PT director, he fought for us to get imaging privileges in the hospital and to have direct access. And I know a lot of facilities, even if their state has full direct access, it might be more limited in the hospital or in a larger organization. And I think people should be fighting for those things. If your state allows you to do imaging, but your workplace does not, I really think I'd love to see more PTs in their workplace, in their smaller communities, being advocates for that kind of work. A lot of us are practicing far below our scope. And like I said, I've had some really positive experiences in those realms where people I was working with were able to push and make those things happen in our workplace and really change our scope of practice. And finally, to loop onto the back of that, I do see in these smaller organizations, when we're out doing our private practice, what I've seen is I'm finally able to use my whole scope, everything I've been educated in, because the laws here in Colorado allow me to do so. And I feel like that PT that was always described to me, going in, direct access, seeing a patient with an issue, having a possible diagnosis and ordering the imaging when indicated to confirm it. Like, I really didn't see that type of practice until I was out on my own. So that's another, I think it's a big appealing piece of our profession for people who maybe want to go out into their own practices, being able to practice the way you were actually trained.
Yeah.
So we've gone on, and I think we should wrap up this episode. Although I see a burning thought in your mind, Matt, what is it?
I was just gonna say, innovation always starts small and then it grows, right? And so that's how it is. Like, small practices are the ones that are usually kind of pushing innovation, and then it finally grows into those bigger practices. And I couldn't agree more. That I think you put it together, closed it out nicely. Let's say that.
Fantastic. Thanks for listening to this episode of Ortho Static, the podcast of the Academy of Orthopedic Physical Therapy. Please support us by subscribing wherever you get your podcasts. Go on our YouTube channel, subscribe there, and follow on all your social media platforms, Instagram, Facebook, X, all that stuff. We're there, and it helps the organization if you can sign up to make sure this stuff's coming across your feed and engage with the stuff that speaks to you. So thanks again, and we'll talk to you soon.